You have an announcement you want to make that sounds very interesting. What is it that's on your mind?
Well, as you know, Rick, America's Medical Society is planning. We're in the planning stages, but it's going to happen sometime later this summer or fall, a live as well as broadcast debate event. And I challenge within the present White House administration or anyone else within the government or anywhere within the country, anyone, the highest level individual who is a proponent of Obamacare, of the PPACA, Patient Protection and Affordable Care Act, I challenge that individual to a debate on the merits of Obamacare.
Okay, so you are challenging the highest-ranking expert liberal who supports Obamacare to a debate, a public and open and transparent debate on the merits of the president's health care plan.
Correct.
Anywhere, it could be not just here in San Diego or California, the highest-ranking supporter of that plan in America.
Yes.
Well, that's interesting. And why so?
Well, I'm sure you've talked about it on your show, and we all read it in the news. It's just Obamacare has become this politicized thing. And what the public may not realize is not only is the majority of physicians not behind it, and the dubious white coat event that the AMA posed at the White House a year ago, was just for show. But more than that, there are real life patient. All of our lives are, in a sense, on the line, going to be seriously affected. This isn't about politics; it's about medicine. Now, some people say, "Well, Obamacare is about socializing the country," and it is, and it's more than just a medical issue, of course. However, what I want to debate is the real life patient care, health care effects of this horrible monstrosity of legislation. It's 2,700 pages that get in between the doctor and the patient, in between what we have now, which is very high-quality medical care, okay, and what they're going to create, which is going to be this mediocre system, long lines, restrictions, rationing, that sort of thing. And so I want someone to step up and debate, as we said, as the highest-ranking person in the country we will accept, and we will have a debate on the actual merits, the medical merits of patient care at the bedside effects of Obamacare.
And, what I like about your idea, Dr. Dorin, is this debate that occurred among lawmakers over the last year or so on Obamacare. I don't feel like the general public really was a part of that debate. I mean, it was like an argument among lawyers, an argument among insiders. And what did it mean? What did it mean to the average Joe or Joanne in America? And if I understand you correctly, what you're saying is let's disclose that in an open and public debate. Let's let everyone know what's really in it.
Exactly. Well, Rick, as you may, as I know we've talked about it before. But speaking of lawyers, the Obamacare legislation, 2,700 pages, did a very good job of taking things away from patients, nurses, physicians, hospitals, manufacturers of medical equipment, insurance companies, etc. The one group that they actually actively, aggressively protect, take nothing away, and actually help are the trial lawyers. Interesting. Well, one of the biggest supporters with unions of the liberal Democratic establishment. The trial lawyers make no sacrifice, and yet they contribute absolutely nothing to the delivery of care to patients. Of course, Obamacare also does so many other things that are concerning. I mean, disconcerting. Let's look at the creation of 200-some-odd new agencies, 17 major insurance company mandates, Medicaid increases by 16 million enrollees, $529 billion in cuts to Medicare, $569 billion in higher taxes. I mean, this is just the tip of the iceberg of this disastrous legislation.
You have an announcement